Depression can be analyzed on multiple levels. On a neurological level, depression has to do with an imbalance of neurotransmitters, serotonin and dopamine especially, and that actually impairs the communication in your neural networks. On a psychological level, we can think about depression as driven by this low mood, this sense of worthlessness, self-critical thinking, and that's often associated with these known events that are associated with depression, a lot of adverse life experiences or losses. On a social level, you can think about depression as being fed by feeling disconnected from others, and that just really amplifies the feeling. So the question is, what is the root cause? The best science that we have is that it's not one thing, that it's a complex interaction, that you may have a genetic predisposition to it, but your environmental circumstances may be such that that genetic predisposition is either expressed or not expressed. Depression can affect the brain in a number of ways. Number one, it can affect neurotransmitters. So there can be an imbalance in key neurotransmitters like serotonin and dopamine that actually impair the communication in the neural networks in your brain. Number two, there can be actually volume loss in key structures if you've been depressed for a while. So things like the prefrontal cortex, your executive center, the hippocampus, which is associated with learning and memory. Another way it affects the brain is in the HPA axis or the stress response axis. It can actually be overactive. And then a final way that researchers are noticing is that over time, if you've been depressed for a while, markers of inflammation are elevated. And so all of these things are good to keep in mind that actually when you're depressed, it actually has a real world impact on your physical health.